So we discussed in previous lectures that after a history of sore throat due to streptococcal infection, a person can develop post-streptococcal glomerulonephritis as well as he can develop IgA nephropathy as well as he can develop ITP or HSP. So these were some disorder that a person can develop after a history of upper respiratory tract infection due to streptococcus. Now, there's one more complication of infection with streptococcus pyogenes or streptococcal infection, that is rheumatic fever. Antibodies are formed against the antigens of streptococcus pyogenes that cross-react with the uh, structures present in the body and result in rheumatic fever. Now, what is the diagnostic criteria for rheumatic fever? Diagnosis is based on evidence of recent streptococcal infection accompanied by two major criteria or one major criteria with two minor criteria. So recent streptococcal infection, evidence of recent streptococcal infection along with two major criteria or one major with two minor criteria. So what is the evidence of recent streptococcal infection? Rising titers of streptococcal antibodies, a positive throat swab, and a positive rapid group A streptococcal antigen test. So these are the 3 points for evidence of recent streptococcal infection, either antibodies against streptococci or a positive throat swab or a positive antigen test. Now, what is major criteria? Major criteria is erythema marginatum. Erythema marginatum, as its name indicates, it's erythema, that is redness. Marginatum means the margins are prominent. Erythema with prominent margin is known as erythema marginatum. Erythema marginatum is usually present on the trunk and limbs. This is the diagram of erythema marginatum. You can see that the margins of this erythema, they are prominent, and the center is light. That's why it is called erythema marginatum. The other major criteria is chorea. So remember that in rheumatic fever, three organs that are mainly affected, they are heart, brain, and joints. And the fourth one is skin. So these are the four major organs which are affected by rheumatoid arthritis. So the major criteria is based on the involvement of these four organs. Erythema marginatum, that is a pink ring with prominent margins. Involvement of brain can result in chorea, or nervous system involvement can result in chorea. There is polyarthritis. And remember that this polyarthritis is migratory polyarthritis, like we discussed in Ritter syndrome or reactive arthritis. Migratory arthritis that is associated with urethritis and conjunctivitis is Ritter syndrome, and migratory polyarthritis that is associated with brain and heart symptoms and erythema marginatum, that is rheumatic fever. So the first major criteria is skin involvement, that is erythema marginatum. Second is brain involvement, that is chorea. That is joint involvement, that is polyarthritis, that is usually migratory. And this arthritis migrate from one joint to another, then to another. And heart involvement can result in pericarditis, endocarditis, or epicarditis. Any kind of carditis can develop. Endocarditis will result in valvular abnormalities such as mitral regurgitation. And we discussed in CVS chapter that mitral regurgitation is associated with pansystolic murmur. So the most common valve that is affected by rheumatic fever is mitral valve. Though any valve such as tricuspid valve, aortic valve, pulmonary valve, any of the valve can be affected, but the most common valve that is affected is mitral regurgitation. Sorry, mitral valve. And the this involvement of the mitral valve can cause mitral regurgitation as well as mitral stenosis. So someone with a rheumatic fever has a pansystolic murmur in the mitral area, then it will be mitral regurgitation. And if a mid diastolic murmur, then it will be mitral stenosis. Uh, Another major criteria is also related to skin, that is subcutaneous nodules. So any of these two criteria, if they are present, then the most likely diagnosis will be rheumatic fever. Now, the major criteria was based on the clinical features of the organs that is involved. Minor criteria is based on uh, some lab investigation and some non-specific symptoms. So a raised ESR or CRP, it's a minor criteria. Fever is a minor criteria. Arthralgia, arthritis is inflammation, and arthralgia is simple joint pain. In arthritis, because of inflammation, there will be joint swelling, while in arthralgia, there will be no swelling but only pain. So, fever and arthralgia, these are the minor criteria that are based on the sign and symptoms. And minor criteria that is based on lab investigation, they include raised ESR and prolonged PR interval. So this was major and minor criteria for the diagnosis of rheumatic fever. Edema marginatum, it is usually common in children. So remember that the most, if the in the questions they ask you about the most likely laboratory value to be abnormal, then your answer will be ESR. And the most specific or the most appropriate test, if they ask you about the most specific or most appropriate test, then your answer will be ASO titer or ASO antibodies. Because we discussed that ESR is a non-specific marker of inflammation. So it is raised in other condition as well. But raised ESR, it is a feature that is present in almost, it is a lab abnormality that is present in almost all the patient with rheumatic fever. So if they ask you about the most likely laboratory value to be abnormal, then it will be ESR. And the most specific or the most appropriate test to confirm the diagnosis, then your answer should be ASO antibodies. Because ASO antibodies can sometimes be normal in the initial stages of the disease. That's why it is not the most likely laboratory value that you will find normal. The management of rheumatic fever is very simple because it's a post-streptococcal infection. So penicillin, oral penicillin V can be used in the treatment of rheumatic fever. And for pain or arthritis, NSAIDs are first line. And treatment of any complication if the patient develops, such as heart failure. So this was all about rheumatic fever, its diagnosis and management. Now, example of how a scenario of rheumatic fever can be asked. A 14 years old boy presented with painful joints and rash. The pain was started on the knees, then it's now affecting ankles and elbows. So the pain started in the knees and now it's affecting ankles and elbows. So it's migratory arthritis. And because it's involving more than one or two joints, so it is polyarthritis, migratory polyarthritis. The rash are pink annular on the trunk and upper and lower limbs. So the description of the rash here is that pink annular, pink rings or pink annular rash that is predominantly on the trunk. It is erythema marginatum. So a 14-year-old boy with joint pain, he is having migratory polyarthritis. So it is fulfilling one major criteria. The second major criteria is erythema marginatum. So two major criteria are present. It's rheumatic fever. He has a history of sore throat 2 weeks ago, a pansystolic murmur. So he has a history of sore throat also 2 weeks ago. A pansystolic murmur is heard over the apex. So apex, which is usually the mitral area, there is a pansystolic murmur. So one more major criteria is also present. So three major criteria are present. The most likely abnormal lab value is ESR. The most appropriate lab test is entry streptolysin. The most commonly involved valve is mitral valve, and it can result in mitral stenosis as well as mitral regurgitation. So more sensitive test is ESR, and more specific test is ASO titer. So this was all about rheumatic fever, its management and diagnosis. I hope it's clear to everyone.